Thank you, Madam Chair. Good afternoon. I've been asked to share some brief thoughts on how academic institutions are innovating in these areas of linking agriculture, health, and nutrition. It's a bit of a challenging topic because this integration is fairly recent in academia. It's little publicized and little shared. But this is perhaps a very good place to begin. By my calculation, there are 94 academic institutions attending this conference. That includes the rich and famous diversity of Indian universities, but 2/3 of the institutions here are from outside India. So it's a great place to begin to talk about academics working in these areas. Indeed, there are probably more, because quite a few of you are probably like me, hiding behind the name of a center or an institute, but are actually academics. I'd like to make 4 points around innovation in academia. And the first is about the role of universities, part of the problem or part of the solution. When we look, as we're doing across this conference, at the misalignment of agriculture and health and nutrition at the governmental sectoral level, at the intergovernmental level, and the private sector, some of us think a lot of this really has to be traced back to universities, because it is in universities that all of us in this room have learned our specialisms in relative isolation, be they agriculture or health, and joined those tribes that have been separated from each other ever since. Universities are in that way very much part of the problem, but they're also part of the solution. And Leszek Borsiewicz, in a parallel session earlier today, made a very impassioned and convincing argument that where else but in universities do you have the clustering of academic disciplines relevant to addressing this problem, and also the open-minded and curiosity-driven nature that would allow that to happen best. So universities are very much charged with that challenge, I think, perhaps over all the other sectors of beginning the exercise of integration. My second point is about complexity. When we were setting up the Leverhulme Center for Integrative Research in Agriculture and Health by drawing together the agriculture, health, and educational colleges of the University of London, we quickly discovered that we had a rather bigger problem than we thought in achieving this. It wasn't just a sectoral problem, it was an interdisciplinary problem. That is to say, we do have sectors, agriculture, health, and nutrition, but within those we have disciplines. And while economists and biologists, epidemiologists, anthropologists are all to be found in agriculture and health sectors and departments, they pursue their disciplines in different ways, and this compounds the challenge. So if you put a table in a room and brought a health economist and an agricultural economist together and you said the subject was nutrition, you might find people talking from one end of the table in terms of calorie sufficiency or nutrient sufficiency, and the other in terms of quality or disability adjusted life years. And that resolution, finding a common way to talk about nutrition and agriculture and health, is one of the real academic challenges for innovation in universities. That allows me to make a small plug at this point, because that is precisely what IFPRI and our center are going to do in May as a follow-up to this conference, bring together health and agricultural economists to talk about metrics and the commonality of metrics. So there's an announcement in your folders on that, and I'm very pleased if you could join us with that, for that debate and resolution. I think the important point here, and the one that we're learning and several other colleagues I've talked to here are learning, is that we really need to move away from the conventional serial model of sectoral and disciplinary engagement and research. And by that I mean, well, for instance, a natural scientist comes out of his laboratory after 2 years and says, I've got this new crop variety that I've produced, finds a social scientist, said, can you help me do some research to see how we can get people to use this? And the social scientist goes away and plans a program, and then comes back to the natural scientist and said, what are precisely the properties that are good about this plant? And said, well, it's nutrition. So having planned their work, the social scientists then go ask the nutritionist, how do I measure nutrition in my social science study? That's a serial approach. And what we need to see much more of, and what a number of the presentations in this meeting have already begun to identify, is a more parallel and integrated approach, where all of these groups are discussing the problem from the outset and working together. My third point is about training. Universities train tomorrow's development professionals. We can and should begin now to incorporate elements of agriculture, nutrition, and health training into that education. We've had a lot of discussions. Per Pinstrup Anderson has mentioned this. Lawrence Haddad has mentioned we need to build training into curricula. The question is, where do we do it and how much do we do it? I believe that the real need is that we should be specialists, but we should be aware and understanding and appreciative of the other disciplines around us, and that could certainly be achieved. And we heard an example on the first day from Per about his new integrated agriculture and health PhD programs in Cornell, where students come together and solve a problem together in an interdisciplinary way as part of their PhD training. Now, finally, my comment is about perseverance. Academic groups which undertake interdisciplinary research such as this and training face many challenges. They face the challenge of lack of departmental support, lack of relevant career incentives, challenging publication environments for interdisciplinary work, lack of funding. All of these can be addressed, and I've seen a tremendous positive feeling on the part of many sponsors of academic research in this meeting to funding interdisciplinary research in future. This challenge may be more difficult in resource-poor academic environments, such as the universities of the South. On the other hand, these institutions may have less baggage in terms of disciplinarity than some institutions in the North. I think there are opportunities at both ends, and that this meeting might be a good catalyst for bringing together those universities, and perhaps an output of this might be for the universities present to form a network to discuss innovation and new ideas in bringing together agriculture, health, and nutrition. Thank you.